Hello there and welcome to the channel. I'm Stephen Bunting and I'm a physiotherapist working in the northwest of England. For more information about me and all the other MSK conditions I've covered so far, check out the website PhysioMSK.com. So this video discusses bursitis. This is a fairly common cause of soft tissue swellings around various parts of the body. It's a really interesting condition, and once you know a bit more about it and why it's happened, then you can usually get it better fairly easily. As with all my clinical information videos, I will tackle bursitis by asking the three most common questions asked by people after diagnosis. Number 1, what is a bursitis? Number 2, why have I got one? And number 3, what can I do about it? Okay, so on to question 1. What is a bursitis? And to answer that, we first have to discuss what a bursa is. Well, we've all got bursas all over our bodies, and when they're doing the jobs properly, we don't even know that they're there. They are fluid-filled sacs that live between tissues that would otherwise rub against each other, causing friction. Usually between bones and skin, tendons and bone, or to prevent different tendons from rubbing against each other. We have them around most joints in the body. We have a lot of them around the knee, but also the elbow, shoulder, the hip, the ankle and the wrist joints. In a normal bursa, there is a tiny amount of fluid inside, just enough to provide a lubrication effect as one surface rubs against the other. The best description I've heard of them is that they are like a balloon with no air in, just a tiny amount of olive oil to stop the internal surfaces from sticking to each other. And if you then place this empty, flat, slippy balloon in between two moving surfaces, then you can see how this would work as an anti-friction device. And that's exactly what bursas are. Okay, so let's get into the details of bursitis, and in particular, why they occur. Well, quite simply, if you provide more friction to a bursa than it can cope with, then it's going to respond by producing more fluid to basically fill up the balloon. The most common bursitis that we see are around the knee and the elbow, mainly because these areas are bony and commonly rub up against other surfaces. Kneeling, for example, can overload a bursa on the front of the knee called a pre-patellar bursa and cause a swelling directly over the kneecap. Pre-patellar bursitis used to be called housemaid's knee or carpet fitter's knee because both these activities involve long spells of time in kneeling, often on hard surfaces. The next most common knee bursitis occurs just under the kneecap and is called an infrapatellar bursitis. The common name for this condition is clergyman's knee because it's caused by kneeling in the upright prayer position, which compresses the bursa between the skin and the patellar tendon. The common elbow bursitis is called an olecranon bursitis. The bursa sits between the olecranon, the bony tip of the elbow, and the triceps tendon, and it can become overloaded when leaning through the elbows onto hard surfaces for a long time. Now, before we go any further, an important note here. If you think you have a bursitis and you can't think of a cause, so for example, if it's a knee bursitis and you haven't been kneeling, or if it's an elbow bursitis and you haven't been leaning through the elbow, then do go and see a medical professional. There's a number of inflammatory conditions, with gout being top of this list, that can also cause a bursitis, particularly an olecranon bursitis on the elbow. In fact, whenever I see an olecranon bursitis, or indeed any bursitis where there's no obvious friction cause, then I always take a blood test to look for gout and various other inflammatory conditions as well. Because if it is, for example, gout, then any treatment should be directed at the gout and not the bursitis. The bursitis will only go away when the gout is under control. Okay, so that leads us nicely onto the last question. Assuming that your bursitis is not related to gout or any other inflammatory condition and is caused by a friction overload of a bursa, then let's discuss the treatment options. Well, of course, the first thing to do is stop whatever you've been doing that might have caused you bursitis in the first place. So if you've been kneeling excessively on a hard surface and you have a knee bursitis, then you must stop kneeling. This might seem obvious, but I've seen many patients over the years who just continue on, and as such their bursitis also persists. If kneeling is part of your job, then you could try a knee pad or a thick kneeling cushion, but that still might not be enough. You might just have to stop kneeling completely for a few weeks until the bursitis gets better, and then use a kneeling pad to stop it coming back again. The main treatment for bursitis is with anti-inflammatories. If the bursa is small, then the rubs and gels might be effective, but for most bursitis, the anti-inflammatory tablets are going to be the best option. Not everyone can take anti-inflammatories though, so do go and see a pharmacist or a prescriber first to check that you can take them. They're going to need to be taken at maximum dose for a few weeks in most cases. By using anti-inflammatories and stopping the provocative activity that you've been doing, the vast majority of bursitis will settle right down over a few weeks. For the persistent ones, you're going to need to see a clinician, as usually the next step is to aspirate the bursa, which involves draining off some fluid with a needle and syringe, and then sending the fluid off to the labs to check for infection or gout. But if it is a simple bursitis, then these tests are going to be negative. And if the bursitis then comes back again, and it often does, then a clinician may need to aspirate again, but this time inject some cortisone into the bursa, which is a powerful steroid-based anti-inflammatory. This usually resolves the problem. The final treatment for a persistent bursitis, which has resisted all attempts at treatment, will be surgery. A birsectomy involves removing the bursa and any bony spurs or thickened bits of tissue that might be irritating it. Of course, you will need to see an orthopedic surgeon or a plastic surgeon to see if this might be an option for you. Okay, well that's about it. I do hope you've picked up something that might be helpful if you do have a bursitis. Do check out the website for more information. Thanks very much for watching, and bye for now.